Hey, it's Jess from Head to Toe Health. Just going to run through a few rolling exercises. So first of all, we're going to start with the lower back. So you're going to come over the roller, hands behind the head, elbows up towards the roof, and just make sure you're stabilised through the upper back and you're not arching too much. We're just going to run from the pelvis up to the start of the ribs there. So it's a very short range. So we're going to just warm up that area, just do a few rolls there, about 6. And then from there, we're going to come onto the side of the lower back. So between the pelvic bone or the hip bone and the ribs. So there's only a short space there. From that point, you're going to roll back to about 45-degree angle on that. So that'll be quite tender in most of those points. You're going to roll up and down nice and gently and find a couple of spots that are more tight for you, more tender. You're going to hold on that spot, try and relax over the roller as much as you can. Relax your legs down and you'll get a better response from that. You're going to go for an intensity of about 7 out of 10 and hold it for 60 to 90 seconds each one. So once you're at that 60 to 90 seconds, then you can keep rolling, move to the next point that you found was tender and hold it in that position. Again, 60 to 90 seconds.